If you are over the age of 40 and you're looking at improving your intimate performance, increasing your confidence, and offering the best to your partner, this video is for you. My name is Dr. Marina Beshay, and I am a certified family physician in Ontario, Canada. I've been practicing as a family physician in the Canadian market for over a decade now. I'm also a certified provider for the O shot and the P shot. And I'm also a certified trainer who has been training other healthcare professionals on how to do these procedures. Let me give you overview of the P shot. P shot is simply PRP injection that will be injected in your private part. If you haven't heard about the PRP before, PRP simply is when we draw the blood from you, just like when you go for a regular blood work, the blood will be spin on a very high speed in a centrifuge. When the blood spins so fast, that splits the red blood cells from the plasma. The plasma is the part that floats on the top, and this part is the part that has all of the growth factors, all of the platelets, all of the nutrients in your blood. So after numbing your private part very well using a strong medical grade numbing cream, this plasma will be activated and will be injected right into your blood vessels. When we inject the plasma in your blood vessels, we expect the plasma to stimulate your collagen, to stimulate your circulation, stimulate your nerve endings, which will reflect on the size, it will reflect on the circulation, reflect on the performance, and also reflects on the sensation. Part of the injection will be done to the tip of your organ, and the tip is the part that's responsible mostly for the sensation and the pleasure that comes with having a sexual relationship. This part will improve in the sensation, especially if you have any other factors that can reflect on the sensation, like diabetes, for example, if you have history of any chronic medical condition, or even just with aging and the mechanical factors that you can get exposed to all through the years, that can definitely affect the sensation and the pleasure that comes with having a relationship. We expected that to improve with the P shot. Just for you to know, you are not alone. Statistics now are showing that at least 50% of men in the North America are having some sort of changes in their performance, especially after the age of 40. A lot of times, more than 90% of the times, these changes that can happen are related to other factors that you cannot really control, like heart problems, medication side effects, chronic conditions like diabetes, smoking, so many things that most of the times it's out of your control. So I will go now to the demonstration. So I love to demonstrate and explain to you exactly how the procedure is being done, because if you haven't had it before, I'm sure that you have 100 questions in your mind. So we usually draw at least 30 cc of the blood. This blood will be spun in the centrifuge. We will have enough amount of PRP to be injected. So just for demonstration purposes, if we imagine that this is the shaft here and we have the glands here, so in one session, what I will be doing is, if we imagine that this is your blood vessels here, okay, so the injection will go right in your blood vessels. The numbing will be the numbing cream will be covering your whole organ before the procedure, and we will leave the numbing minimum of 20 minutes before we do the procedure to make sure that you are completely comfortable during the procedure. Okay. What's gonna happen now is when the PRP is being activated, I will do at least 2 shots in the shaft on this side and another 2 shots here on this side. That's minimum of 4 shots in the shaft. What this will do is it will help to go right into your bloodstream, circulate, helps to stimulate your collagen and your circulation, which is the number one reason why men will have changes to their performance, because all of the circulation changes that happens over the years, especially with the cholesterol and the pollution we get exposed to and aging and everything else, our blood vessels are not performing the same. So we need to improve the circulation. Once we improve the circulation here, we're correcting the problem naturally without exposing you to any external factors. Keep in mind, we're all talking about the plasma that's coming from your own blood. Now, one of the injections that's very important and it makes all of the difference here is the one injection or two injections that will go in the glands. I will do minimum of 2 injections in the glands. The glands is the part that's responsible for the sensation. It's the part responsible for the sensation, the feeling, the pleasure, all of the satisfaction that comes with having a relationship. You will notice a big difference in the sensation after you get the procedure. Keep in mind that PRP is like planting seeds. You planted the seeds today and you don't see that plant tomorrow. Like planting the seeds, and then you need to give it a few weeks for you to be able to see the results. Sometimes people see results quicker, sometimes it takes more time. It depends on so many factors, including your age, your general health, response to the injection. Just like any medications, like might be responding very well to one you might be responding very well to one medication, another person will take quite some time to respond to the same. After we finish the procedure, you will be sent home with a brand new, after we finish this procedure, you will be sent home with a brand new penis pump. What this pump will do is it will create negative pressure. You will start using the pump as soon as you get home. The reason why we don't get you to use it in the clinic is the pump is brand new and the one we use is extremely advanced. So you really need to charge it a little bit before we use it. So we don't open it to charge it for you. If you want to do that at the clinic here, you're more than welcome. You will be using the pump 5 to 10 minutes twice a day for minimum 1 month after the procedure. What this pump will do is the pump will create negative pressure around your penis here. And what's going to happen is this will help to get the PRP to freely and evenly distribute all through your blood vessels. So the PRP is going everywhere. There is no single circulation. There is no single blood vessels that's missing any PRP. The PRP is being evenly distributed. It's going to give you the maximum results. The other thing is the pressure that we are trying to apply here by creating this negative pressure can also enhance the process of collagen stimulation. This is why we actually advise you to continue to use the pump for minimum 1 month after the procedure. This pump will be included in the price. A lot of times my clients tell me that when they use the pump before having intercourse, it actually helps to strengthen and it helps to stretch their part so they feel a lot more and a lot more confident. If you have any questions about how to use the pump, I usually explain to you how to, but that's always easy to explain. One of the questions I get asked a lot is, do I have to start a testosterone therapy to improve my sexual performance? Most of the cases, the answer is not really. There is actually very small link between the amount of testosterone you have and your sexual performance. Sexual performance is mostly related to the mechanical factors and the topical area and the circulation in this part. And when I do HRT treatment, which is a completely different topic, I always make it very clear to my clients that going on HRT or going on testosterone therapy is not going to really reflect on your sexual performance. For that particular reason, I don't usually run blood work for testosterone level before we do this procedure because the link between the testosterone and the performance is not that high. If you think that you might want to get your testosterone tested and you might be a candidate for HRT, this is a service that we offer here at Revive, and I will be more than happy to help you with that. But not necessarily this has to be linked to the P-shot. Complications of P-shot. Keep in mind that when we talk P-shot, we're talking about PRP, which is your own plasma. So complications from P-shot is mostly injection, though the procedure usually is pretty comfortable with the strong numbing we use, but it's still injection, so you can experience a little bit of like pinch feeling, you can experience a bit of bruises, and of course a little bit of discomfort during the procedure and immediately after for a few hours. That's mostly the main complications you might experience. Actual procedure doesn't really come with any portfolio of complications because at the end of the day, we're using your own blood. So complications or reaction or allergy or anything to happen using your own blood is close to none. Who will benefit from P-shot? P-shot is a great procedure that can be added to anyone mostly to enhance your performance more than anything else. Boost your confidence, make your partner happy, and make yourself more comfortable during this intimate time. P-Shot is available for anyone, mostly after the age of 35, 40. And believe it or not, I actually get a lot of clients in this age group simply because with all of the social media that's happening and all of the educational that's going on now, people knows about it and they actually want to get the best results and they want to offer the best to their partner. Shot can also be great for anyone who's having actual erectile dysfunction, so they are trying to improve their performance as well, especially if you have any chronic medical conditions that can be affecting your performance, like heart problems, diabetes, longer history of smoking, cholesterol, especially if you're taking medications that can reflect negatively on your performance, like some of the blood pressure medications can do that. Some of the heart medications can definitely affect your performance. You cannot stop those medications for sure because that's very crucial for your life, but we can try to correct the side effects by offering the P-Shot for you. One thing you keep in mind is the response to the P-Shot can be completely different from one client to the other based on so many factors. P-Shot works by stimulating your own collagen. So the amount of collagen that you can produce when you are at the age of 40, for example, can be completely different than the amount of collagen that you can produce when you are at the age of 75. So if you are at the age of 40, you can definitely produce more. So you will be able to enjoy a lot of good results, maybe after 1 or 2 procedures. Somebody else who's a little bit older might need 2 or 3 procedures to experience the same results. Same as if we're talking about diabetes or chronic medical conditions, it's not a contraindication to have the procedure. You can still get the procedure, but you also keep in mind that maybe you will need more sessions to be able to experience the same results. How many sessions do I need if I'm getting the P-Shot? So I usually say simply depends on where you want to go. So after every single procedure, you will definitely be able to experience some results. But by the end of the day, you decide where to go. Just like when you go to the gym. How many times do you need to go to the gym? Well, it depends on your goals. You don't want to wait till your muscles are completely gone and then you start to go into the gym. And if you hit this point, you might want to go to the gym more often in order to rebuild your muscles because you waited for so long up until your muscles were completely wasted. It's the same thing. Keep in mind that your private part is just an organ in your body, just like everything else. So how many sessions do I need from the P-Shot? Again, depends on your age, your condition, medical conditions, which medications you take. This is why it's very crucial to have a good, thorough consultation with you. And I'm the one who's always doing this consultation because this is a pure medical topic that I would love to assess based on your medication list. Make sure you bring them with you and based on so many other factors that I would like to discuss with you as well. We usually recommend 3 sessions on average. After the first session, you will be able to see some results. Like I said, remember PRP is like planting seeds. You don't see the results the very next day. You can have sex on the same day, but you don't see the results on the same day. We always recommend the 3 sessions simply because with one session, you can't really correct everything that was happening over so many years. One session can take you from here to here, but maybe your target is to go there. So if you have a high target, then you need to go for more sessions. A good thing is the results accumulates. So it takes average of 4 to 12 weeks of your body to start producing more collagen and to open new circulation and new nerve endings. So this is why I always love to space a procedure 4 to 6 weeks apart, because this is the time when your collagen stimulation is really happening, and this is usually the best time to give your body another session, which is within the 4 to 6 weeks frame. So the amount of collagen will start to accumulate. So I always say, if you start from here and then the first session is taking you there, expect the second session to take you from here to much higher. So now the amount of collagen is accumulating and the amount of circulation is being open. This is why P-Shot is a great way to help with Peyronie's disease, which is a curvature and the painful part that can affect a lot of men And that happens with chronic medical conditions in particular, especially diabetes and high cholesterol and some heart conditions. And it can also happen because of aging. So with the PRP injection and the circulation, it can help a lot to strengthen and to straighten your penis and to straighten the shaft, as well as using the penis pump. I've seen great improvement in my own clients when they have Peyronie's disease and they get the P shot, as well as all of the studies that we have online on the priapusshot.com website, which is the official website that's done by Dr. Charles Ronald, to explain to you more about the procedure, can benefit from the procedure, and any questions that you might have in your mind. I hope this video answered a lot of your questions you might have about the P shot. If you still have any questions, you can definitely feel free to give us a call or check our website. And you can also go to the official website, priapusshot.com. This official website is done by Dr. Charles Ronalds. Dr. Ronalds is the one who created the whole P-shot idea, and he's the one who trained me personally, and he's the one who certified myself. And he's the one who gave me the to start training other healthcare professionals as well, to be able to help even more clients all over the North America to do these procedures and make happier clients. If you need any help, please let us know. I would love to answer questions if you have any, and see you at the clinic.